things that I see that I know that I could improve on would be a lot of the major issues that they're concerned as well would be pore size, and you notice they start getting patches of pores that start to enlarge, and across the nose you start getting prominent pores. Okay. The other thing is the fine wrinkles. You start getting them. The skin under the eyes starts getting fine wrinkles. They'll also start getting some, we call them dynamic wrinkles. Go ahead and scrunch for me. You start getting dynamic wrinkles in here, and then across the forehead. Elevate your forehead. There you go. Okay. And then the other place that seems to be forgotten a lot is around the crow's feet. Go ahead and smile. Yeah, very prominent when they smile big. The other issue that tends to happen as we age is you'll start to lose volume under the skin. So you'll notice things like the nasolabial fold and the marionette lines down here, in particular women tend to lose volume at the corner of the mouth and begins to collapse the corner of the mouth a little bit. And that translates into looking older.
And I'm going to have you close your eyes. There's going to be a series of 2 flashes, and you can come out when I tell you to, okay? Taking the picture now. Okay, you can safely come out. This here is the pores, all these little green spots here. She's at 49% for that one. Room for improvement with the pores is just keeping them clean so that they can shrink. UV spots is sun damage. All these little areas that are circled in yellow is sunspots. Some that may be seen right now, some that are deeper that may not come out until later. And she's at 20% for that one. The browns is basically an overproduction of melanin in the body. Some of this is caused by sun damage, some of it's caused by aging. These are much deeper than just the stuff that's on the surface. She's at 26%. The reds in the skin are basically little areas that are lacking in oxygen. The veins kind of come up to the surface a little bit, or broken little capillaries, things like that. She's at 36% for that one. And porphyrins are bacterial clogged pores. She is at 9%. Everybody has bacteria in their skin. We would want to see it a little bit better than 9% for somebody in her age group. Again, it's all about keeping the skin clean.
Wow, that was fascinating. We got a chance to see how Visio works. So what's our next step?
All right, so our next step is we're going to apply some numbing cream and get the skin nice and numb so she can handle the procedure. This is Angelique, and she's going to apply a 30% lidocaine cream to the area that we will be lasering, which would be her face.
Everything.
Yeah.
I'm guessing it takes about maybe 3 to 5 minutes to put on, but how long does it take for the numbing procedure to actually work?
We'll leave the numbing cream on anywhere from 45 minutes to an hour and a half, depending on what the plan is. For her, 45 minutes will be fine. It just takes a few minutes to put on. And so we will meet again when we're ready to do the procedure in an hour.
Oh, the one we've been waiting for. What are we going to make happen now?
All right, well here we are. We've washed all of the numbing cream off of her face and we've cleaned her face off so there's no water or anything that's going to inhibit the laser beam. We've then gone through precautions to protect everybody's eyes. The patient, Gina, her eyes have been covered as well with metal covers. And the Sciton laser has been already preset. This is going to be your first treatment, so the settings have been already predetermined for me. It's a computer that allows me to maximize the treatment plan. And so here's how we would start that. We're also going to have vacuum, because it does create some smoke. And then we use a chiller that does blow cold air to take a little bit more of the sting or discomfort out of the procedure. Once again, just trying to make it as comfortable as possible. Okay, so here we go. On the count of 3. 1, 2, 3. And as you can see, it makes very, very precise, little tiny microscopic holes into the skin, 60 per square centimeter. Okay, so I'm gonna count of 3, take a deep breath and hold it. 1, 2, 3. So this allows me to get right up and close, get all the surface areas. Okay, so the only part that would be left would be to do around the eyes. And today, this is actually very close enough for her. We got pretty close. We can do the eyelids, and I would just turn it down. And have the patient keep her eyes closed. Come across here. Get a little snap. 1, 2, 3. So once again, if you can get the eyelids, it helps tighten the skin and allows for a little more tightening, and that is something that a lot of people really like as well. And the fact that it is an erbium laser, as said before, it's a very safe laser. So I can safely do this around the eyes. So that's it. That would conclude the treatment. And now hi Morris. Well, here we are a week later, and as you can see, she's survived the procedure. So Gina, how's the week been for you? Experience
Awesome.
okay?
Very, very good. I was really impressed on how fast I was back to normal.
Okay.